Good evening, you're watching Eswatini TV News Bulletin at 8, read to you by Notilesi Tole. First up, let's have a look at tonight's headlines. Government has extended the partial lockdown by a further 4 weeks. The sale of alcohol in the country has been banned immediately for the next 4 weeks. UNFPA has donated 3 million emalangeni worth of PPE to the Ministry of Health. And now the news in detail. The government of the Kingdom of Eswatini has extended the partial lockdown by a further 4 weeks effective from midnight on Thursday, the 21st of January 2021. According to the acting Prime Minister, this decision was informed by the increasing number of COVID-19 infections and fatalities in the country.
In order to save lives and allow our health sector to breathe, Cabinet, under the counsel of and guidance of Their Majesties, and exercising Regulation 52 of the Coronavirus COVID-19 Regulations 2020, has taken the decision to extend the revised restrictions by another 4 weeks, effective midnight Thursday, 21st January 2021. This measure is meant to disrupt the galloping spread of the virus, as the past weeks have clearly indicated the need to further strengthen our COVID-19 response efforts as a country. We have an opportunity over the next 4 weeks to act responsibly as individuals and communities to save lives. We owe it to ourselves, we owe it to our families, and we owe it to our communities and our great country. In the meantime, government will continue to strengthen our health interventions to identify and attend to more of our sick. We are cognizant of the shortage of oxygen in our health centers caused by the high demand, and continue to increase capacity and provision of this vital resource for the pandemic.
The sale of alcohol has been banned with immediate effect in the Kingdom of Eswatini. According to the acting Prime Minister, alcohol will not be sold in the country for the next 4 weeks to prevent the spread of COVID-19.
His Majesty's government wishes to announce that the sale of alcohol is banned with immediate effect for the duration of 4 weeks. Any retailer who offends this directive will face serious consequences, including the suspension of their trading license, as it has happened recently to other defaulters. It is unfortunate that we have witnessed many imbibers ignoring directives to consume alcohol at home, thereby congregating in groups where they remove masks and share their drinks. An intoxicated mind does not have the capacity to think rationally, and this is dangerous at a time when every action has a consequence. Our law enforcement officers have been assaulted by these groups that they were trying to disperse for illegally gathering and drinking alcohol, with police vehicles pelted and vandalized in the process. We cannot tolerate this behavior as a nation. The ban of alcohol sale, however, is not a ticket for the black market and illegal home brews to emerge and thrive during this period. Law enforcement officers including community police, working with the regional task teams headed by the regional administrators, will be very vigilant in monitoring that this illicit activity does not resurface. We urge all Emaswati to be responsible.
Government is pleading with Emaswati who are preparing to bury their loved ones to ensure that their remains are not brought home from the mortuary. Instead, the body should be taken from the mortuary straight to the cemetery to avoid the spread of COVID-19 among mourners.
We plead with all the bereaved to ensure that bodies are taken straight from the mortuary to the gravesite for burial to avoid gatherings at homes. Bringing the remains home presents the temptation to view the body, and this is deadly. Funerals are still restricted to 50 mourners under strict adherence to COVID-19 protocols. We also strongly encourage those who can afford to consider cremation as a way of speeding up burial and reduce the potential of transmission and relieve the overload in our mortuaries. The serving of food in funerals is now strictly prohibited.
His Majesty's government wishes to inform the nation that the late Minister of Public Service, Honorable Christian Miegeni Njangase, will be laid to rest on Saturday, the 23rd of January 2021. A state funeral will be held in his honor at his home at Mkwakweni in the Shiseleni region, and the service will start at 9 a.m. Attendance numbers will be restricted in respect of COVID-19 regulations. Members of the public can join the proceedings through YouTube. May his soul rest in eternal peace. This is an official statement by the acting Prime Minister, Themba Masuku. United Nations Population Fund has donated personal protective equipment PPE worth 3 million emalangeni to the Ministry of Health. The consignment was handed over by UNFPA's head of office in Eswatini, Margaret Twala, to the Minister of Health in an event held at Matapa.
The United Nations Population Fund is not extending a helping hand to the Ministry of Health for the first time, as in the early days of the outbreak of COVID-19 in Eswatini last year. This organization gave PPE worth millions of emalangeni to the Ministry of Health. UNFPA Eswatini's head of office, Margaret Twala Dembe, says their office in the kingdom wrote to the UNFPA head office to seek for the PPE in order to help Eswatini. She says the organization values the safety of health workers in the fight against coronavirus.
It's mainly PPE, which is N95 masks, surgical masks, coveralls, aprons. It's mainly what healthcare workers need to protect themselves, Honorable Minister, because as UNFPA we want to ensure that services continue to reach out to women and girls, and in ensuring that women do not die out of giving life.
When receiving the gift, the Minister of Health, Lizzie Nkosi, said health facilities in Eswatini are always in need of personal protective equipment or clothes.
The pieces that are brought in today are some of the critical pieces. As you can see, the coveralls are used inside when they're looking at critical care, high care, and it's very important for our health workers to stay protected. So our stock was very, very low, so this couldn't be more timely. The disposable coveralls are used all the time. I'm sure you can see from level 1 of PPE right to level 4 of PPE. So it's a piece that is used all the time as they walk in to work with any patient. When they walk out, they have to take it out and start all over again and don themselves and put those pieces back on again. So this is very much part of the response that keeps health workers safe from contracting COVID.
Eswatini is in the crucial stages of the outbreak of COVID-19 as the country first experienced the second wave of this disease in December last year. For Eswatini TV News, Hlengiwe Ndlovu with Muzimkonda in Matapa.
The Organization of African First Ladies for Development has donated different types of face masks to Eswatini worth 400,000 emalangeni after the organization was approached by Inkosikati Magelamathebula for assistance in the fight against COVID-19 in Eswatini. The face masks are being kept at the Central Medical Stores in Matapa and were received by the Minister of Health, Nkosi.
OFLAD is the Organization of African First Ladies for Development. And they are organized across Africa, and here in the kingdom, Makhosikati onke are members of OFLAD. Makhosikati are actively involved in various projects and development within OFLAD. Inkosikati Lamathebula was the one that wrote to them looking at the COVID situation, and they have come up with this donation through the Africa Union. The donation here is mostly of face masks. Face masks of children that we don't normally buy within the thing, but there are children who get ill who may need to use face masks, and they have various levels of face masks, including the N95s that are protected with a foam thing on top, so you can reuse them. Amongst the face masks, they brought some dust protectors, which means the people who are, like for instance here, there are people who are lifting boxes, there's a lot of dust, so even if they have a surgical mask, it is nice to have a dust protector on top. So we have a few of these. So on behalf of the Ministry of Health, I would like to thank Makhosikati, thank Inkosikati Lamathebula particularly for their active involvement with OFLAD, and thank OFLAD for this donation that is worth 400,000 emalangeni of face masks that are going to be helping us in this response.
The whole region has roped in the community police in the fight against COVID-19. The regional administrator, Princess Tanzile, says they reached this decision after seeing a drastic increase in the number of people infected with the virus.
The Hoho region has overtaken the Manzini region in recent weeks as the one with most people infected with COVID-19. A statement issued by the Minister of Health, Nkosi, on Tuesday showed Hoho to have 5,745 cases of the virus. The regional administrator, Princess Tanzile, says this is very worrying.
We're also going to add on other stakeholders like the chiefs and other people, because we believe that the chiefs are the people who are in charge of the communities. Whatever happens in a community, the chief must be informed. So if we alert the chiefs how bad the situation is in the region, they will also come up with ideas of how best we can curb this pandemic.
Chairman of the region's COVID-19 Compliance and Protection Task Team, Kulani Mamba, says they will continue working hard to stop the spread of the virus.
We know that there are some people who are still not obeying the regulations, that are doing things unlawfully. So we're asking the community police officers to help us in making sure that there is compliance in the rural areas, in the communities, with regards to funerals, with regards to gatherings, and compliance in the business area.
Talking Kwanyana, a community police at Lobamba, urges communities to follow the COVID-19 guidelines.
Siyamonitor ukuthi la ipotini vele umuntu akathenge ahambe angahlali ngoba wahlala utawusobambela lomunye kanti mhlambe nakasekhaya lakhe utawukhona lokuthi nathele yedwana.
Since the outbreak of the pandemic in the country last year, 13,000 people have been infected and 403 have died. Reporting for Eswatini TV News, I'm Nelson Ndlangamandla with Temkosi Mavimbela at Ezulwini.
The probability of the anticipated Cyclone Eloise to hit the kingdom over the weekend is still high. However, the Meteorology Department will only be able to detect exactly how the cyclone will move in the next few days. The director, Dudu Nhlengethwa, says the nation will be kept abreast as the weekend approaches.
Tropical Cyclone Eloise has eventually got into Madagascar, and we are expecting the cyclone to come out into the Mozambican Channel later today. At this point in time, it's difficult to say what the impact in Madagascar has been. Reason being, it's in the northern part where there isn't much happening, and also it's not a good reference point is the tropical cyclone weakened as it crossed over Madagascar. And we're expecting this tropical cyclone to continue through the Mozambican channel and get to the Mozambican shores by Saturday, during the day on Saturday. And then from there it will head inland. As we had said earlier on, there is still uncertainty as which direction it will take from there. But our models are beginning to converge, and we are hoping that very soon we'll be able to give more detail as to what can possibly happen. But at this point in time, it is safe to say that we still see Tropical Cyclone Eloise affecting us as a country. Particularly, we need to be warned of the potential of high wind speeds, in which could, depending on the track, be any part of the country, but particularly the west. And also, in the east, and also we need to also be aware that tropical cyclones often come with heavy rainfall, which is still a potential for the country. And also, as the tropical cyclone passes, it will be able to couple some systems that might continue giving us rain with the potential of thunderstorms. So these are the things that we are warning the nation over. And the period that we need to take precaution for is basically starting later on Sunday all the way through Tuesday. That is the time where we are expecting to have some potential impacts from the tropical cyclone. Again, I will say that as our models are beginning to converge, we'll be able to give more information as to what will possibly happen. At this point in time, we request the nation to do all it can to ensure that should the storm come into the country, we minimize the impact.
Women who are under the Vugani Bomage project, which was spearheaded by the business Eswatini's Women Wing, has generated 70,000 emalangeni in revenue. According to the CEO Nathi Dlamini, the money has been invested back to the project in all 4 regions of the kingdom.
The Ministry of Tourism and Environmental Affairs launched the Phathasa Konawe campaign aimed at reducing the number of plastics used by consumers. This initiative came about after the ministry realized poor disposal of the plastic bags end up having negative effects on the environment. The ministry collaborated with different shops in the kingdom to encourage consumers to bring their own bags when they come to the shops. This has presented a women's project, Vugani Bomage, with a business opportunity to sell environmentally friendly bags to these shops. Business Eswatini's Chief Executive Officer Nathi Dlamini explains the progress of the project.
Vugani Bomage have secured a contract on behalf of all the women from the various tinkundlas in the country. As we speak, these women have made over 33,000 bags, and at a cost of over 75,000 revenue. 75,000 revenue during these times is really nothing to look down upon. I think it's very good money, and it's going back to the villages from where they come from. And the major retail chains which have been supporting us, and we would like to mention them here, especially OK Foods. I want to mention Pick and Pay, Boxer, Spar, and Buy and Save, and other some small outlets. These are the retail chains that have been buying these bags from these women, and we are saying thank you to them for this support. Please continue to do so.
Dlamini says they hope to take this project to other constituencies. Currently, the project is in 3 constituencies, which are Nhlambeni, Lobamba and Manzini. Over 60 women have benefited from this project. Reporting for Eswatini TV News, I'm Nelson Ndlangamandla with Patizwe Msibi in Babane.
Increased connection speed and capacity are just some of the benefits of the much talked about 5G network, which will eventually be used in Eswatini. Although some people spread misinformation about the network, the Ministry of Information, Communications and Technology says 5G is the way to go.
5G, a topic that is the talk of the town. This is because of various reasons, including its misinformed link to the spread of COVID-19. In some countries, people were seen burning 5G network cell phone towers in a bid to stop the spread of the virus. Experts in the field of ICT, locally and internationally, have come out to say that 5G is safe. Acting Director of Communications at the Ministry of Information, Communications and Technology, Jabulani Simelane, says 5G has many benefits which include increased speed and capacity. As the world is faced with a challenge in the health sector, Simelane explains how 5G can be helpful in this area.
It will bring a lot of benefits because it will enable the health practitioners, first of all, to be able to remotely do diagnosis, carry out, even do prescriptions remotely. Actually, as a matter of fact, we've been pushed way ahead of what we thought. COVID-19, without relating to 5G, has actually pushed us to virtualization. Life is about virtualization now. You have to hold virtual meetings. You've got to do this virtually. Even health diagnosis have to be done virtually now. Eventually, physical contacts will have to be minimized. So 5G comes with all those benefits. It brings the necessary speed and bandwidth that is necessary to connect remotely and be able to deal with all of these things. So that's the benefit of 5G. There is a whole lot more other things. We're talking about Internet of Things, IoT, and all of these things. Smart homes and all of these will really come to benefit.
Simelane says Eswatini does not have 5G yet, which makes any link to the network spreading COVID-19 false. He says 5G is not different from 4G, 3G and 2G, which are available in the country and widely used by locals. For Eswatini TV News, Temgosi Mavimbela, Mbabane.
Eswatini has recorded a total of 43 malaria cases in a period of 20 days. National Malaria Control Program's Health Promotion Officer Kapsile Nhlengetwa says the country might see an increase in malaria cases in the coming weeks due to this weekend's expected rainfall.
According to the Ministry of Health's report, Eswatini recorded a total of 268 malaria cases in 2018 compared to the 724 that was recorded the previous year, which is in line with the country's target of ending malaria by 2023. National Malaria Control Program's Health Promotion Officer Kapsile Nhlengetwa says the rainy season has impacted negatively as the country has recorded 43 cases of malaria in a period of 20 days, with one fatality that was recorded last year.
We have around 43 cases for the month of January only, and then if we are looking at the season since July, we have around 150 cases for the 2021 season. I'm mostly concentrated in the Lubombo, around Spofaneni. Localities are Makakasi and Manyovu. And we are currently conducting our indoor residual spraying, which we normally call spraying. We started in Woho last season, and now we are in the Lubombo region. We were currently in the Lomahasha area, but we had to move because we had to attend to Spofaneni. So this week we are spraying around Spofaneni. And we have managed to spray approximately 33,000 structures.
Kapsile further appealed to Eswatini to take note of malaria symptoms as they expect a rise in malaria cases in the upcoming weeks as the country might receive rains this weekend. She says there are COVID-19 symptoms that are similar to those of COVID-19, that is headache and dizziness, which Eswatini must quickly rush to the clinic whenever they notice them and refrain from using home remedies. Reporting for Eswatini TV News, I'm Samgal Suekoza with Kian MCB in Mbabane.
A very good evening once again. You're still watching Eswatini TV. Now let's have a look at our sports news. The president of Eswatini Angling Association, Derek Hoff, says they will host very few tournaments this year because of the increase in numbers of people with COVID-19. Hoff says they had lined up international events, which they are still not sure if they will occur or not.
The ever increase in numbers of COVID-19 cases has caused uncertainty over sports activities, as they sometimes are forced to suspend their games due to lockdown sanctions by the government. The Eswatini Angling Association says they will put some of their games on hold during this period.
The official program in terms of events this year is kind of on hold as a result of a notification received from the National Sports Council in response to the partial lockdown and the new laws that were passed at the beginning of this year and the end of last year. So unfortunately for formalized angling, there's no activities that are planned. There may be some activities later in the year. So the World Championships in November in the United States may still take place. It really is dependent on the ability of the rest of the world as well to participate. So we are waiting to see if that's going to happen or not. But that's the first week of November. Other than that, I think there may be a Region 5 in Zimbabwe. But again, it's to be confirmed, and the closer we get to those dates. So unfortunately, I think we are going to lose another year of formalized angling.
Derek concluded by encouraging everyone to learn more about the sport, as they can access many things on social networks which can make them understand the sport better and maybe take it up, and everyone should follow all the regulations put in place by governments in fight against COVID. Reporting for Eswatini TV Sports News, I am Patizo Msibi. Babane.
That's all for now. Before we conclude, let's have a look at tonight's headlines. Government has extended the partial lockdown by a further 4 weeks. The sale of alcohol in the country has been banned immediately for the next 4 weeks. UNFPA has donated 3 million emalangeni worth of PPE to the Ministry of Health. And with that, we sum up our bulletin for the evening. Up next is the weather update from myself and the crew here at Eswatini TV. Thank you for watching. Good night.
Here at Spa, we've got everything you need to get your kids ready for school. Like the Spa Good Living College exercise book for only $3.49 and this Typec A4 paper for only $54.99. Save on all your back-to-school essentials at Spa.